We started in 2002 by few people from Bhubaneswar and Cuttack. In 2002, and LB Prasad started in 2006. You can see the photograph in 2007. If you can recognize the then Chief Minister of Odisha inaugurated. And this is a synergism between LB Prasad and Drishtidan. And I'm happy that one of the founding member, Professor Padi, is present here. So the journey started in 2002, but the fast cornea we retrieved in 2004 September. It took almost more than 2 years to get the fast cornea. So you can see 5,000 mark we reached after 2016, and it took 14 years, 2 to 14. And the next 5,000 in 5 years, and another 5,000 in 3 years, and I'm expecting next 5,000 will be in 2 years. So this is now, East Zone is the list in India. In India, we almost collect around 50,000. So Drishtidan Eye Bank contributes to 5% of Indian collection. And last year it was 6th rank, before that it was 8th, and before that it was 10th rank. So every year it is jumping 2 rows. If you see the voluntary and SCRP, again I have divided into 2 decade, and the last one is only 3 years. So the numbers, absolute number, if you see both the hospital corneal retrieval and voluntary is increasing. But the proportion of voluntary is not increasing. The absolute number is increasing. Probably the HCRP numbers are more. However, we need to increase the voluntary also. Same, if you see, it is 15.4x in this 10 years in journey. If you focus this number, the LBP network we used to start with first decade, we used to 70, almost 60, more than 65%. In the second decade, it is reverse. So we have started sending outside LBP also at 64%. If you see the last 3 years, is still increasing. So basically the utilization is increasing. The utilization is very high compared to other. So it is not only the number of quantity, it is also quality. If you see the lamellar keratoplasty number also increasing. However, in India, I always say that because therapeutic keratoplasty is the majority number, so it will not cross, but lamellar keratoplasty, that means the lamellar surgeons are increasing across India. So again, within Odisha also the number is increasing, the surgeon outside, everything is increasing with the time. But the number outside, it is dramatically increasing because, so where do we get the cornea? To start with, it was only in Bhubaneswar, then we expanded to Cuttack, but now you see the most of the district, it is the corneas are coming, and it is like a spoke and hub model. They come to here, then we do the evaluation, again we distribute throughout the country. Last few years we started adding one more SCRP center every district. Now the focus is on southern Odisha. And getting from the Odisha, we distribute throughout the country by train, flight, everything. And if you see the optical lamellar keratoplasty number is gradually increasing. So not only again the quantity, the quality. You can see Harminder Dua visited us in 2016. We started doing automated keratome, and we are the few eye bank who distribute pre-cut cornea to eye banks. And recently we have started DMEC also. In LBP Hyderabad we started spreading, but in Bhubaneswar also with few months we will start distributing. And what is the impact? So basically the children, you can see there is a sclerocornea after corneal transplant. And people of Odisha do not have to go out for the cornea transplantation. And it is 0 waiting list in Odisha from last few years. Maybe last, initially 2007-8 we had, but for last 10 years, 15 years it is 0. So this is possible not only for the few people. We started in 2002, and you see this is 2024. When we celebrated our 20 years and 10,000 cornea. So basically teamwork requires commitment, hard work, and follow through for this success. Thank you.
Thank you, Dr. Sujata. Any questions?
I invite Tapas to the podium, please, for the next talk.
Hello, ma'am. So what were your challenges when you started early on this eye bank, and how did you overcome these challenges when you faced newly, when it was newly started?
I think it is universally for all eye banks. First is the awareness. So because you saw 2002 March it was started, and 2004 September we got the cornea. Mainly the awareness. Although the number is increasing like anything, still I feel the awareness is not gone to normal. Voluntary proportion is not much. So basically the challenge is awareness.
I think
And
it's awareness of both like whoever the patients are going to donate and their families and also the hospitals also. Like
Yes.
even the hospital also has to be aware that they can do this freely.
yeah, the hospital side, still the awareness has increased. Much
Increased,
what we
yeah.
started in 20 years back, it has increased. Maybe the voluntary will take still more time
yeah.
to
More
get the cornea.
acceptance is there.
Just
Okay.
want to know one thing. In trade, there is an US company who is selling human preserved corneas, and they are supplying throughout the globe. So how is it possible?
It's a bioengineered cornea. There are a lot of
No,
companies
human
who are
cornea.
working.
They say it is human cornea, sterile and preserved.
Yeah,
and-
okay. Okay, that gamma irradiated. All
And the-
those are mostly.
And the cost is 500 US
Yeah.
dollars.
Yeah, all those gamma irradiated and cryopreserved, most of them are for lamellar keratoplasty, not for
No,
full
no,
thickness
for-
or endothelium.
No, for everything they have. Just now I talked to them.
Usually
and
tectonic purpose, not for
no,
optical
for all,
purpose.
for optical also they are saying, and the cost is 500 US dollar for each one. Then they are ready to supply to anywhere.
Yeah, but whatever existing, most of the artificial
No, I
cornea,
was surprised.
bioengineered cornea
I
are
was
for
surprised.
stromal,
That's why I am asking
stromal
you whether.
substitute.
No, whatever it is, it's a breakthrough, ma'am, and I think if it's already available,
Yes,
you
you're
do
on.
have a scope to go and talk to the person concerned, because if it has to be clearly outlined for
Yes,
in the
yes,
coming
yes,
days,
yes.
whether it's possible or not. So you being a pioneer and say,
Yes,
please
yes.
find some time to go and talk to the person yourself.